My wife, Julie, was a lot of things to a lot of people. She was a mother, a sister, a great wife, but she was also a hospital administrator, and she was a lifelong nurse. And she cared for people her whole life, all those people she cared very dearly about. Julie was diagnosed with ovarian cancer at stage 3. It's a late stage. You'd prefer to catch it earlier, but unfortunately that's kind of typical of a lot of ovarian cancer patients. It's caught late.
If my mom were here right now, I know that she would be heading this organization up herself. Before she passed away, she told us, we need to carry this fight on for her. We need to save lives.
The reason I started this organization is I really don't want to see other women go through that, having this disease detected at a late stage.
The mission of the Julie W. Schaffner Endowment is really to promote awareness among the general public of women who might be at risk for ovarian cancer. Women need to know the early warning signs, the risk factors, and really need to know what to do if they fall into that category. Additionally, we're looking to fund research to help find more reliable tools than what we have now.
It is hard with women because we have a lot of the similar symptoms for ovarian cancer that are normal in a lot of your everyday activities. I think you do have to listen to your body. I think that's very important.
Ovarian cancer frequently grows silently and painlessly in the beginning. It's really not known whether the majority of ovarian cancers present along a continuum of pre-invasive disease, stage 1, stage 2, stage 3, stage 4.
One issue with ovarian cancer is, as we know, it's hard to detect early. Part of that is the part of the body that's affected is difficult to examine and to detect a mass, for example, on a routine physical exam in comparison to, for example, a breast lump. Ovarian cancer is not among the most common cancers in women. It's, I think, about 9th most common. But ovarian cancer is notable because the mortality rate is so high. Ovarian cancer, that number is about 2/3 or 66% of women with ovarian cancer will die of the disease. What would be very, very helpful in ovarian cancer would be to develop better imaging tools. Easy to do, easy to undergo tests where we could look at the ovary, look at an area that's sort of very deep inside the body, and find itty-bitty masses rather than when they're larger and spread outside the ovary.
There's a lot of work being done in the field of ovarian cancer, and our organization can help by providing resources to help support some of the good work that's being done in this area.
Advancing the research program at Lutheran General and collaborating with Rosalind Franklin through the fellowship and also in partnership with the Julie Schaffner Endowment would allow us to focus on gynecologic cancer research on a bench level or at the bench level. And I believe that's very important to move beyond where we are today, which is surgery followed by chemotherapy, which is far from perfect.
As an ovarian cancer survivor of 5 years and the mother of 3 girls, it is very important to me to support Julie Schaffner's Endowment for Ovarian Cancer Research Early Detection.
Funding from the Julie Schaffner Endowment is critical to target research projects specific to ovarian cancer.
Julie has been a very dedicated individual and is loved by many. And through this effort, through the efforts of Advocate Lutheran General and Advocate Healthcare, through the efforts of the Julie Schaffner Endowment, we are going to advance and continue to make ovarian cancer a disease that people can live with, people can understand, but more importantly, advance efforts so that we can continue to improve what we need to do for people to deal with ovarian cancer.
It takes an army of people and a pile of resources to fight diseases like cancer. And it takes a very special army to fight this disease, ovarian cancer. It doesn't fight fair. It's hard to detect at an early stage. It's difficult to treat. That's why we need you to join our army. Help us fight this disease. Help us come up with better screening tools. You know what? Help us fight the good fight.